Hi, Victoria here, welcome back, and you get to see Khamsin's second part of her treatment today. Beautiful Khamsin is 35 weeks pregnant in this video, and she experiences in this video the cranial balancing and neck release techniques that are part of core therapy. And stick to the end to see how she feels at the end. You could see her reaction to having those elements of the treatment. And then join me next week when I treat Phil with core therapy. Now, he's quite a sportsman with golf and tennis, and has had and is having some sporting injuries at the moment that I am working with, and it seems to be helping him. So I ask him how he's feeling, and then we crack on with a good treatment for him. So please like, subscribe, please comment. It's nice to interact with you, and I'll see you next week. So we left Khamsin at her last appointment, having had the kinesiology muscle tests, followed by the tweener to her back, which is the realigning for the spine, just to relax the muscles and realign the spine to the pelvis and down the legs. I checked the orientation of the pelvis by holding and standing at the feet. Now this treatment continues with a nice shoulder push to relieve, relax the weight of the shoulders. And now I'm encouraging Khamsin to relax her head backwards in this beautiful neck release. You know, everyone I meet, everyone I treat needs a neck release. We all carry a very great weight of our heads on our bodies, our spine, our neck, and more often than not, perhaps our neck is held too far forward or too far back, in that the weight of the head is exacerbated by compounding the muscles and the ligaments around the neck. So it's really important in every core treatment to ensure and encourage each person's neck to relax, release and lengthen. I'm now feeling the spine around the 7 vertebrae of the neck, and deep into the occiput, which is the bone at the very base of the back of the head. As I turn the head, I'm also feeling, assessing the whole time to see how easily it turns, how far, whether I can feel any crunching or restriction while I'm turning and holding the head. I would never turn it too far or force any action. It is simply encouraged to do what it wants to do. And sometimes I also encourage with my words by asking people to take a long breath and to relax their muscles as they exhale. Occasionally I find an area within the neck that needs a little bit more time, a little bit more focus. And in this area of Khamsin's neck, it's very common to be tight at about C2, the 2nd vertebra down. You may recall in the first treatment last week where C1
was caught, which means that it was blocked and attached to the occiput, the bone above, and it needed that neck release that I've just performed in order to help unlock C1 from the base of the scalp, which will then prove well when I retest the muscle that showed that spasm, that strain there, which was the bilateral psoas test, which we will come back to at the end. So now I'm able just to show you in a little bit closer up exactly the action that I'm performing on the neck. There are 7 main vertebrae here, from the very top underneath the occiput down, and when I find an area that needs a little bit more attention, I just I focus the intention of healing and warmth directly to that area. I'm totally focused and concentrating on sending healing to this area. You can see from Khamsin's posture that she's very relaxed. None of this is hurting at all. It all feels right. It's one of those movements and techniques that just feels the right thing to happen while you're receiving it. Having turned Khamsin's head one way and then the other, this technique of assessing and treating the spine in the neck through to the shoulders, the deltoids, really helps to release that upper tension, which is so common amongst all of us, but maybe especially amongst those carrying extra weight, another baby, another beautiful human being, and that is going to bring a certain amount of muscle tension around the shoulders, neck and upper back. Because of the angle of the couch, you can see I'm standing for this maneuver instead of sitting at the couch, because Khamsin is beautifully sitting up with her knees supported by a couple of cushions. She's very relaxed here, and I perform a few more neck releases. That is that orientation where her head is central, it's aligned beautifully with her spine, and I support her whole weight of her head while encouraging her to breathe out and release backwards, almost as if she were looking at the back wall behind her, while I support the very top of the spine in between C1 and the occiput. And sometimes I will travel slightly further down the spine, perhaps in between C1 and C2, that's the atlas and axis. And depending how that feels, I'll either carry on in that area, or I may travel a little bit further down, for instance between C2 and C3, and then carry on down the spine till I get to C7. You know, many people ask me how I remember the amount of information about the structure of the body, bones and muscles, but it fascinates me so much that I seem to have a thirst for knowledge of the anatomy and physiology. I also like to impart this information with you guys. The beautiful thing about giving a neck release is that every time it is performed, it achieves such a greater relaxation, not only in the muscles, but also you may even notice here that each time it's performed, the head and neck is able to tip slightly further backwards. This achieves such a beautiful release and feeling of freedom and height and lengthening. It achieves space in between each vertebra at the level of each disc and also in the muscles and ligaments running alongside the spine. Beautiful feeling of lightness. And having performed the more tactile and muscular techniques of neck release, I'm now tuning into some Qi Gong, which is a wonderful healing treatment, which is an ancient technique having been used primarily in China hundreds of years ago. You notice my hands and fingers are mainly based around the back of the neck and the base of the skull. My focus and intention here is directed at the healing and the heat that I am feeling through my hands and palms. I'm now feeling quite a strong tingling sensation. My palms and fingers are emitting and receiving a huge amount of heat. And heat is a wonderful feeling when healing is taking place. I move the tips of my thumbs very gently to the side of the cranium at the temporals. My fingers are still placed under the occiput, the very top of the neck. And not only am I feeling the healing, the energy, the heat, tingling, but also I'm seeing colours behind my closed eyelids. And more often than not, those colours may well be identical in shape, movement, tone to the ones that Khamsin may well be seeing behind her closed eyelids. If I was to ask Khamsin what is she seeing right now, we may well concur. But more often than not, I'm normally silent during a treatment in order that the client is able to sink further into their state of healing. This Qi Gong, beautiful healing treatment is producing the most amazing effect here with Khamsin. Not only will you see that her breathing has calmed, also she is able to release her muscles completely. There is no requirement from me to perform muscle tests, nor turn over, nor to be focused on anything I say. She simply needs to relax. The energy now achieved between the two of us is achieving such a deep wavelength within her nervous system that it's almost at a state of sleep. Some clients indeed do fall into a light sleep towards the end of a treatment. Some clients may visualize beautiful and empowering self-compassion and deep introspection of the subconscious while in this beautiful state. It is an amazing feeling between therapist and client during these moments that heals as it works, heals into the future, and leaves us both feeling incredibly relaxed and at one with ourselves. We are so lucky to be able to enter this amazing state of consciousness. A little movement with my thumbs very gently implies that I'll be releasing my hands. Having updated my notes, I now very gently start to communicate with Khamsin. First of all, just asking Khamsin to take some deeper breaths, taking oxygen into the lungs, and now becoming aware of the hands. I encourage Khamsin to stretch out through the hands and then become aware of the pelvis and down the legs. Perhaps stretching slowly into one leg before stretching into the other. This is a way of communicating the brain to the body, that they're in tune with each other. Having done a few subtle and gentle movements of the lower body, I ask Khamsin to take another long deep breath and feel the breath into the shoulders and down the arms. Stretching out fingers separately, thumbs and palms, turning into the wrists. You may want to follow this as we go through the whole body, rotating into the shoulders one way and then the other. And now pushing the shoulders down. You may want to follow this. Just see if you can push down at the shoulder points by pulling the arms downwards and see if they bounce back up. It's only a very minimal movement, but it really helps release the trapezius muscle across the top of the shoulders and back. Having performed a long body stretch and a few deep breaths, we now revisit a few of the kinesiology muscle tests that weren't happy at the very start of the treatment, which you may have seen at the start of Khamsin's core therapy treatment number 1. I'm retesting the psoas muscle here. Just need to remove one of those pillows that's getting in the way. So the psoas is all to do with the lower thoracics and the very top of the neck. I test one and then the other in turn. Oh, I notice that that left one is still giving way. There isn't enough strength. I test it again just in case it's a one-off. No, there's still some movement. So I come round the couch and I just want to have a feel mid-back at about T11, T12, very base of the thoracics, to see if there's any sensitivity there when I just a little touch on the side of the spine. I'm working on the very base of the neck there as well. I've got my other hand at about C6, C7 on the side of Khamsin's right side of the neck. Now I retest the psoas and I'm putting a lot of pressure on there, but no, it's completely strong, so that's really good. And that tells me that I will need to work on that area next time I see her, if I do see her again before baby is born. Now I'm just having a few little looks at the orientation of the hips. They're feeling much better, although I haven't been able to do too much there because of her advanced pregnancy. So Khamsin is now feeling wonderful. Thank you for joining me. Please subscribe and I'll see you again next week.